So if you want to take your health to the next level, today is the episode for you. If you don't know exactly what intermittent fasting is, I'll walk you through it today. And for those of you who know it or maybe even do it, today's episode will remind you why it's so awesome. And I have a lot of clients who have been doing intermittent fasting for a while, but they forget the reason why behind it. Sometimes we just do things because, we feel great. But today, if you're doing it already, this episode is still for you because I'm going to tell you why it's amazing. So when people ask you about it, you could be like, well, this is why. And P.S. for anyone, I do want to say this because I know there are some people in my audience who may find this topic triggering because of weight or body issues. So let me just address that. This conversation is not about weight loss or body size. It's about optimizing your health, and it can be done at any size. And I hope you're able to listen to this episode knowing that I have only love and support in my heart. And I'm going to explain the science behind intermittent fasting. And it has nothing to do with looking a certain way or fitting into a certain size. And if you are listening on the podcast, as always, my hair looks amazing because I use a lot of gel. And I'm wearing the stethoscope that my wife gave me. Thank you, Gina. Other than that, you're not missing anything. Keep washing dishes. So let's jump in and talk about intermittent fasting. And if you know, I always start with a definition. What is intermittent fasting? So intermittent fasting is about when we eat instead of what we eat. It's a timing of eating conversation. And intermittent fasting is a pattern that includes certain times that you eat and certain times that you don't. And there's all different kinds of intermittent fasting. Some people do alternate day fasting, meaning they fast one day, the next day they don't. Some people do what's called 5-2, meaning they fast 2 days of the week, consecutive or not, and the rest of the other 5 days they don't. But what we do at the new method, which I will explain later on, is something called the 16-8 method, which is fasting for 16 hours. Don't worry, you're sleeping half the time, and then eating for 8 hours. And as I said, I'll go over that in a little bit. The thing about fasting, the reason, like the basic reason, and I'll go into more detail, is that your body just needs rest from food. And think about it. Everyone needs time off. You don't want to work 24 hours. Your body doesn't want to work digesting for 24 hours. It needs some time without processing food. And the time that you give it off from processing food allows it to concentrate on other things in the body. It gives it time to repair and clean. The problem is that most of us, or many of us, eat the entire time you're awake. You snack before bed, and as soon as you wake up, you eat something. And so you really never let your body get like 12 hours off, let alone 14 or 16 or 24. And again, the time off from processing food actually activates health benefits. When the body's not busy processing your food, you actually can get some health benefits. And before I tell you those health benefits, I want you to know that we are literally designed to do this. Whatever you believe, God, the universe, either way, we're designed to do this. And we have the ability to survive without food for a prolonged period of time, not only to survive, but to thrive. Because ancient hunter-gatherers, they didn't have supermarkets or refrigerators or food available year-round. Back then, when we were hunters and gatherers, we didn't know if you were going to be able to find something to hunt or kill, or if there's going to be any plants on the ground. So as a species, we had to be able to adapt to times without food. And that's because when we don't eat for a certain amount of time, it actually activates certain systems in the body, which I will get into. And the point is, the fact that we're here as a species means that we not only survive times of hunger, but we actually thrived. It's literally how we survived as a species. So I'm going to explain two things to you. One, how do we survive as a species without it? And two, why some of you listening are like, well, maybe I'm not part of the species because I feel like I'm going to pass out when I skip a meal. I'm going to explain why that happens as well. And to do that, we need to understand a little bit about metabolism. FYI, you are part of the species. You have to remind your body how to do it. Okay, in case you needed to know that. Rest assured, exhale, we're good. So here's how it works. We need glucose to get energy. Everything we eat more or less, is broken down into glucose. There are some fats and amino acids, but I just want to say it. That's not part of what we're talking about. So we eat, it becomes glucose. Every time we need glucose, we have a meal, you get the glucose, you get hungry, you eat more glucose, and round it goes. And that is how most of us survive. But our body is equipped with a really cool feature. By the way, it comes standards. You don't need any upgrades for it. It comes automatic. It's a cool feature designed, but that when there is no food, there's no external source of glucose, we can turn inward and use our own fat to make glucose. There's a fancy name for this process. It's called gluconeogenesis. And so it's a fancy word for turn my fat into sugar. So when we fast, our metabolism switches from using external glucose to using internal fat storage. And during this process of using the fat storage to turn into sugar, there's a byproduct, right? Because it's a different kind of chemical reaction. There's a byproduct called ketones. This is why people say the word, this is why it's called ketosis. So when we turn inward to use fat to make glucose, we produce these things called ketones. And that's what ketosis is. By the way, that's what we mean when we say keto. Usually most people are saying keto. They don't use it in the right way. But that is what the word ketosis means. It is the byproduct of the process of using fat instead of external glucose, of using our internal fat. That's what ketosis is. So another way of thinking about it is that your body is like a hybrid car, right? You have electric and gas. Gas is carbs or food, and you need to refuel often, and it burns dirty. And keto, which is from fat, right? Using our fat, burns clean. And you have the ability, just like a hybrid car, to toggle between electric and gas. So to toggle between needing external glucose and using internal fat stores. And as a species, we survived because we're hybrid. Sometimes we got food, glucose, fuel, and sometimes we didn't, so we turned inwards. The problem is, so I explained to you now why we survived as a species. And for those of you who are like, I don't know, because when I skip a meal, I get really shaky. The problem is that most of us no longer know how to turn this feature on. So when we skip a meal, our body doesn't know to flip that switch to go internally. And instead, we feel hangry and shaky because our glucose goes down. And we have not taught our body how to turn this feature on, even though it comes standard equipment. So we're going to talk about also how to teach your body to turn this feature on in a moment. But the magical thing is that when you burn fat, when you're in ketosis, it's not just about surviving. It actually activates magical healing mechanisms. They're not magical, but you know what I mean. They're healing mechanisms. So when I'm talking about intermittent fasting or timed eating, again, I'm talking about it for its health benefits. Now, of course, some people will also lose weight on intermittent fasting, but I just don't want this to be a weight conversation. There's enough pressure out there about that in the world. I want you to learn here about how it optimizes our biological pathways that will lead us to health, living longer, increase our energy, decrease our risk of disease, and so much more. So intermittent fasting is rejuvenative and regenerative medicine. This is not a weight loss conversation. We are equipped with over 200 genes that regulate our bodies, and they only go into action when we don't have food. So when you fast, you actually activate an entire healing system that affects your hormones, your cells, your gene expression, your inflammation, your antioxidants, your brain focus, your cognitive function, helps build your bone density. All of this only happens when you fast. So it's a free tool that comes standard that activates all the systems in your body to help protect you, heal you, and live longer. So now that you understand this, now you understand how it works, I'm going to go into even more details of the benefits of intermittent fasting and, of course, how to do 16-8 that we recommend at the new method. So first benefit of fasting. When we fast, it's an opportunity for the body to clean house. When your body doesn't get food or nutrients, it actually stresses a little bit. And that stress, this is good stress, we like this stress, starts a process called autophagy. So it allows your body to break down and reuse old cell parts, get rid of the parts that aren't working so your cells can operate more efficiently. It's a natural cleaning out process that begins when your cells are stressed when food doesn't come its way. So autophagy has a role in preventing and fighting disease because it's a recycling system. It takes out the junk parts, repurposes the salvageable parts, and creates new usable cells. And like I said, gets rid of the old, puts in the new. So it's quality control for your cells. You don't want too many junk components hanging out. And the only time the body does that is during a fast. Well, not the only time, but it ups its game during a fast. And we also have something called mitophagy, which is the same concept of recycling and renewing, but for your mitochondria. Mitochondria, for those of you who don't know, is the powerhouse of your cell. And when your mitochondria doesn't work well, when they don't work well, that is associated with disease and aging. So we get to refurbish those as well. So fasting helps us clean house. And of course, many of us, the way we live today with waking up and eating, going to sleep and eating, we don't allow our bodies to get to do that. Second benefit of intermittent fasting, reducing inflammation. And so many of you, if you're here, if you're listening, it's because you're inflamed, you're in pain, something's going on. During ketosis, the body produces a molecule called BHB. This molecule has been shown to help with inflammation. They've done studies on rheumatoid arthritis, psoriatic arthritis, and they show that fasting was effective in reducing disease symptoms because of this production of BHB. So there's a whole pathway. I'm not going to go into it of shutting down something called IL-17. I'm putting it there if you want to Google it. Bottom line is, when the inflammation goes down, our aches and pains get better, our skin improves, our brain fog improves, so we actually feel better, but we're also reducing chronic disease, heart issues, because inflammation is at the core of every disease. So if we calm down inflammation, we calm down diseases. Number 3, insulin sensitivity. As I said, every time we eat, food gets broken down to glucose. In order to process it, our body releases insulin. Insulin's job is kind of like to push the glucose into the cell. The more we eat, the more insulin we produce. At some point, however, our cells get full and don't want any more glucose. But if we keep eating, the body keeps producing more insulin, but the body doesn't want any more glucose. So you have this thing called insulin resistance because the cells don't want any more glucose, but the body keeps creating insulin. This is insulin resistance. And then we keep eating. We're basically keep feeding this cycle, pushing more and more insulin into a body that doesn't want more glucose. When we fast, we stop this cycle. And this is how we reverse insulin resistance. And it allows the body to rest, reduce the amount of insulin, and regulate blood sugar. Which brings me to number 4, in line with that, diabetes. This is the same reason why it helps people who have type 2 diabetes, even advanced cases of it. Now, this is really huge because I want you to understand something. There is no diabetic drug in the world that reverses diabetes, right? All drugs do is manage diabetes. If you already have diabetes and you're taking medication, it is not curing you. It is not reversing your diabetes. It's managing your diabetes, right? Drugs and insulin, they just keep the sugar numbers in check. So when you check it, it looks fine. Your A1C in check, but it's not actually reversing it. But with intermittent fasting, you can work with the body instead of against it and actually reverse your diabetes. And of course, caveat to that, if you are type 2 diabetic, especially if you're on insulin, be sure to do this with medical guidance so that you don't become hypoglycemic, slow and steady. Number 5, human growth hormones, HGH. It's magic. As a kid, it helps you grow. As an adult, it helps you heal. It helps you look amazing. Human growth hormone, we want it. So as we age, we produce less and less, but we really want it. When we fast, we increase HGH production by 5 times. Okay, so that's a big deal. So we want that. I think we're up to number 6. I didn't number them. So number 6 is it helps you sleep. Routine fasting helps the body get aligned for sleep. It lets the body know, hey, we don't need to focus on digestion right now. Because if you're eating during the evenings, especially close to bedtime, you're actually not preparing your body to go to sleep. Your body's actively engaged in digestion, which creates problem for sleep. But when you go to bed with an almost empty stomach, I don't want anyone to go to bed hungry, the internal clocks in your digestive system is aligning with the clock in your brain, letting things know it's time to go offline for sleep. Intermittent fasting improves sleep in terms of amount of sleep, the depth of sleep, and the sleep cycles. And then, of course, when you get a good night's sleep, you also have more human growth hormone, and that's an all-around win. Number 7 is cholesterol and heart health. Intermittent fasting, I said earlier, reduces inflammation. It reduces triglycerides, blood sugar, insulin resistance, all the risk factors for heart disease. Intermittent fasting helps your brain health. I stopped counting. Maybe that's 7, maybe that's 8. I don't know. Brain health. It increases a brain hormone called BDNF, which helps growth of new nerve cells in your brain. There's so much evidence that intermittent fasting protects against neurodegenerative disorders like Alzheimer's, Parkinson's. And again, I know I've done a whole talk about Alzheimer's, and if you don't know it, please check it out. It's one of the episodes here on the channel. But here's the thing. One of the biggest drivers of Alzheimer's is sugar. Some people are calling Alzheimer's type 3 diabetes. It's diabetes of the brain. Now, yes, just for the record, there is a subset of people who don't have that, and other things that they're exposed to are causing it, mold, Lyme, other things. But for many people with Alzheimer's, it's actually an insulin-resistant conversation. Again, driven by too much carbs, too much sugar, too much insulin. So managing insulin is critical in managing and preventing Alzheimer's. Managing inflammation, which we know intermittent fasting does, helps with preventing Alzheimer's and dementia and cognitive decline. So overall, intermittent fasting is part of the conversation. If you're concerned about Alzheimer's, have Alzheimer's. So many people are turning to a ketogenic diet to help their brain function better. Cancer. Animal studies suggest that intermittent fasting may prevent cancer and may be effective in cancer treatment. Now, this part of how much it affects preventing cancer in humans is still being researched. And so we're making assumptions based on animal studies. But there are certain things that we know for sure, which is that during cancer treatment, intermittent fasting reduces the side effects, reduces complication, increases efficacy and benefits of traditional cancer chemo. So if you are dealing with cancer or have someone in your life that's dealing with cancer, consider intermittent fasting as one of the tools that you're going to use as you get through it. And I'm praying for you. Intermittent fasting overall is anti-aging. It does cellular repair, right? It hormonal changes, fights inflammation, protects against oxidative stress. So the whole concept of intermittent fasting and everything I've just described, in essence, is anti-aging. It helps keep you young. And yes, of course, there is a weight loss component because you technically are usually eating less, so you will lose some weight. But I'm only mentioning it for those of you who are interested in losing weight. But as I said, I don't want this to be a weight conversation. A little side note for women, because there's a kind of double-edged sword here. If you are trying to get pregnant or breastfeeding, intermittent fasting is probably not right for you right now, because when there's less food available and the body does not focus on fertility, okay? The body's response is, not to focus on getting pregnant or to producing milk. It starts to focus on repairing itself. So if that is where you're at, this might not be the time to consider that, because intermittent fasting, if the body feels under stress, fertility will be an issue, menstruation can be an issue, ovulation can be an issue. However, if you have PCOS, intermittent fasting may be the thing for you, because PCOS is caused by too much sugar and starch. It's insulin resistance. It's an insulin resistant problem. So if PCOS is the reason for your fertility issue, intermittent fasting may be the thing to consider. So I know it gets a little confusing here, but I just want to make sure for women of childbearing age that you discuss this, because depending on where your issue is, intermittent fasting may or may not be right for you. Okay, got it. So now you know all the good things about intermittent fasting. Awesome. Great job. I forgot how many there were. 8, 9, 10. Doesn't matter. There's a lot. So again, it may not be for everyone. Again, if you're breastfeeding, pregnant, people on insulin, you need to make sure that you're discussing it with someone who knows what they're doing. But that being said, let's talk about how to do it. So at the new method, we recommend for our patients to do what's called a 16-8 fasting. That means 16 hours not eating, 8 hours eating. So before you get terrified about the 16 hours, remember it includes your sleep time. So basically it looks like this. You eat your dinner and you stop. That's a big challenge for a lot of people. Eat your dinner and you stop eating after dinner. Then you go to sleep at your normal time and you don't eat again until the next day, maybe just a little bit later than you're used to. So the way to do that is you first have to pick a time frame that works for your life. And this is really important. It has to work for your schedule. So many of my patients will say they start eating at 11, they finish at 7, so they eat 11 to 7. 7 p.m. they stop, they start again the next day 11. That's 16-8. But for some of you who eat dinner later, like me, I don't get home till rather late. Sorry, Gigi. We shift it down a bit. I start at 1 and finish at 9. If you're someone that goes to sleep early, maybe you're in bed by 8 o'clock. God bless you. That's awesome. You can shift it up. So, if you work night shift, you might, eat at night and fast in the day because you're sleeping. So find the hours that are realistic for your schedule, for your family. Because that's the first part. If you try to create a schedule, you want to be done at 4, but your whole family eats at 7, it's not going to work out. So make sure you choose a time frame that is reasonable for your life. You finish your dinner, you stop eating at dinner, and then you don't eat again until 16 hours later. That's 16-8. Now that's the goal. It doesn't mean it happens overnight. Don't rush into 16 hours. It takes time to build up. Start slow. Maybe you get 12 hours first. That's fine. We don't want you shaky or hangry. We don't want you fighting with your coworkers or passing out at the gym because you're just so hungry. Work your way into it. When I started this in my team a few years ago, they all had it down by like the first week and I was miserable. It took me weeks to get to 16 and now I can do 18 or 20 hours without issue. So easy, go slow. Don't push yourself to 16. Don't do it if you're not feeling well. Don't forget to hydrate. So not eating doesn't mean not drinking. You have to drink water, black coffee, black tea, electrolyte drinks, no sugar. I just want to say this. Vodka doesn't count. You would think I wouldn't have to say it, but I had a patient who didn't quite know that and felt that he was fasting and every night drank vodka until midnight. And he thought that because it was clear that it didn't count. So I'm just going to say right here, vodka doesn't count for hydration. You do need to hydrate. Coffee, however, is a great hack because the caffeine in 2 small cups of coffee actually doubles your ketone production and turns off the hunger hormone. So that's a good hack to do. And then when it's time to eat, choose something good, right? Don't spend your 11 to 7, your 8 hours eating junk food because it's just going to spike your insulin and it's going to make it harder for you to fast. All right. Some FAQs that I get a lot about intermittent fasting. 1, isn't it unhealthy to skip breakfast? Don't believe the hype. Breakfast is not the most important meal of the day. In fact, that saying that breakfast is the most important meal of the day was invented by Jackson and Kellogg in the 19th century. And guess what they were selling? Exactly. Can I take supplements while fasting? Yes, you can, as long as it doesn't make you nauseous. A little tip, if you take probiotics and prebiotics during the fast, if you could tolerate it, it actually has additional benefit because your belly's empty and those probiotics and prebiotics have a chance to really, get in there. Can I work out while fasting? Yes. Fasted workouts are great. You may need to build up to it. It may be hard at first. Don't push it. We don't need you fainting at the gym, but it's definitely an amazing workout. And consider taking amino acids before a fasted workout. Will fasting cause muscle loss? All weight loss, anything that has you losing weight can cause muscle loss, not specific to intermittent fasting. But it's important, no matter what kind of nutrition you're on, to lift weights so that your muscles can stay the size if that's important to you. And be sure to eat enough during the eating time. And of course, include protein and amino acids. Will fasting slow down my metabolism? Absolutely not. In fact, studies show that short-term fasts actually boost metabolism. Longer fasts of 3 or more days can suppress it, but we're not talking about those. Bottom line is 16-8 intermittent fasting is sustainable, it's safe, and it's an amazing way to improve your health, longevity, and take you to the next level. And of course, I said a lot. This was a really long one. It's almost 30 minutes. Longer than usual because intermittent fasting is so important. I want to make sure I cover as much as possible. You're always welcome to work with me and my team. This is how to reach us at The New Method on just about every single platform except for Twitter, because I talk too much. Find us, send us a message, send us an email at The New Method everywhere. And I hope you become the game changer in your life because you always knew there was a better way. I will talk to you guys next week.